Hey, Miss Houston, could you please introduce yourself?
Absolutely, Mark. So my name's Heather Brown Houston. I'm a licensed professional counselor in the state of New Jersey. I work for Care Plus, which is a large mental health agency here in Bergen County and beyond. And I work here in Tenafly High School as part of a contract that the Board of Education has with our agency. We have three licensed, fully licensed clinicians in the high school, middle school, and elementary school level this year.
That's very nice. I feel like you're providing a very noble cause, and since it's December and we have a long stretch of school, I feel like there's a lot of pressures that we're facing academically and socially. I was wondering what aspects of being a teenager and that life, like what are some of the common pressures you deal with?
Absolutely. That I see in students who I see.
Yeah.
Absolutely. So the primary pressures that I see when I'm talking with Tenafly students are academic and social. I think that's kind of obvious, and you cited those even in your question, but I would just to elaborate on that. I think the amount of pressure that our students put themselves under for being perfect in every area is unrealistic and really challenging. I'll often say to students I'm working with, when I worked really hard in high school and put myself under a lot of pressure in AP classes and all the like myself, so I know a little piece of what it's like to go through that. But I'll often say to them, now that I'm not in high school and a lot older, I won't say exactly how old, if someone came to me and said, you have to be perfect at everything, I would say, and you have to be in leadership and you have to volunteer in all these organizations and you have to do all of these things perfectly, I would say, get out of here. There's no way I'm going to do that. That's not realistic, and I'm not going to treat myself that way by expecting it. I think in high school, we have this expectation that you have to take math and science and social studies and history and foreign language and electives and show leadership and be in volunteers and do sports and do all of it perfectly. And so just taking a breath to say, that's not realistic to do all of those things perfectly. So I think that's a big thing. Socially, I see, if I could speak to the high school, I would just say, I wish you could be kinder to each other. You all are doing such good work. You're all doing such hard things. Give each other a little grace now and then, because so many of the students I speak to feel really lonely and isolated. And yet I talk to all of them and they're all feeling that way. And I'm just, if you could just talk to each other and give just a little bit of vulnerability, a little bit of caring, a little bit of compassion. And I know there's so many Tenafly students who are very caring and very compassionate, but just keeping that in your mind, especially as we go through this busy holiday season. How can I be kind to someone today who might be going through a lot of stresses? And then I would say the third really biggest stressor that I see impacting across the high school is the impact of social media. And I mean, the studies are out, the scientific evidence is clear. There's a very strong correlation. The more time you spend on social media, the more anxious, more depressed, more, tendencies towards self-harm, all increase in direct correlation with each other. Not that there isn't great stuff on there, not that there isn't great ways you can use social media for advocacy, but so often it feeds into these negative thoughts that we have about ourselves, about comparison. It's particularly strong impact on adolescent girls, but it's across the board. It's really challenging and really is a factor that I think plays into the way that a lot of people feel very negative about themselves.
Yeah. You mentioned perfectibility. I think that's a big issue here, but how do you think we as a student body can help remind our peers who are struggling that they don't need to be perfect and that they're okay as they are? Do you think that it's better to give space sometimes or go out and reach out and assume those sorts of things if you see something? What are the signs?
Sure. So several questions in there. So certainly in terms of how we support one another, I am always in favor of more direct communication. Whenever we factor in some assumptions about what we think the other person needs, we are far more likely to get it wrong than if we ask them directly, hey, what do you need right now? Seems like you're feeling stressed. It seems like you're feeling down today. Is there something I can do? And offer choice. I'd like to listen. I'm also willing to give you space if you just need some downtime. So, see, sometimes letting them have the agency, the autonomy to say on their own what's helpful to them. I mean, obviously, my big caveat there is anytime you're worried about a friend and you have any kind of concern that they might be harming themselves or thinking of harming someone else, obviously that's not a time to give space. That's a time to say, I really don't want to break confidentiality, but I know that I need to make this choice and I need to talk to a grown-up about this. And, our guidance counselors here are amazing. I'm so lucky to work with this team here. Come to your guidance counselor, come to your child's CST team manager, go to a teacher, say, I've got a concern about someone, so that we can do what we need to make sure that person is safe. But that's the more extreme example. And if we're talking about the day-to-day, how we support each other, giving people a chance to talk about their feelings, listening non-judgmentally, offering choices like space versus listening versus, would it help you to get a distraction? Can we go out for ice cream? What is it that we can do together?
Right. You mentioned earlier the idea that social media is really harmful towards a teen's state of mind. I feel like it is a big issue that we're facing. It's especially during this holiday season when pressure is ramping up. Do you think that's the ideal way to break away from that sort of comparison idea to better one's mental state? And what are some other methods that you promote?
So when you say, is that the ideal way? So going on social media or avoiding social media?
Yeah, avoiding it.
Absolutely. Yes. Ideal is, it's rare that I'll say this is the ideal way to help everyone, because one of the things about being a therapist is I know every student I talk to over, it's been 8 years I've been here, people I've counseled and, the other jobs I've had over my life, there is no ideal way, because this works great for one person and is like pulling teeth for the other person.
Everyone's different.
So everyone's different. But in general, I think, especially if you're noticing that you're having a lot of negative comparisons of yourself to other people, you're feeling more depressed, more anxious, yes, let's do an experiment. That's what therapy is about, is doing an experiment. Let me try doing this differently this week. And then we'll review next week. Do I feel differently? Oh, well, that maybe works a little bit. So do an experiment. Take yourself off social media for 3 days. See what you feel like. A lot of students feel really anxious the first couple days, because it's a change and change is hard. But by day 3 or 4, they're like, I have all this time. I'm not thinking negative things about myself as much. Maybe this is something I want to scale back on. Maybe I'm going to let it back into my life for an hour a day, but I'm not going to let it in my life for 4 hours a day. Maybe I'm going to have it turned off when I'm studying so I don't have the distraction, whatever it is. Like, figure out what works for you. I mean, I think that's one ideal way. In terms of other ways of managing stress and in the holidays or any time of year, so many come to mind. Mindfulness gets talked over and over again, but again, so much scientific evidence goes into that. And in terms of mindfulness, what we're talking about is being in that present moment with your feelings without a sense of judgment, just paying attention to what you're sensing there. And the more you practice this, the more you can do it over and over again. It was a foreign experience for me when I first started learning about it. But as I've taught it to students, as I've tried to practice it myself, I can sort of drop into a mindful state like this when I'm starting to feel anxious about something. It's like, okay, deep breath. Take a moment, check in. What am I seeing? What am I hearing? What am I feeling? Ground myself in my senses without judging myself. And then come on back 30 seconds later, and I'm so much the better for it. Mindfulness is all over the internet. Look for that. There's a practice called self-compassion that I think is really key, and so many Tenafly students, sometimes you're not compassionate with each other, but so many of my Tenafly students are not compassionate with themselves. And I'm like, you're so amazing. You're doing all these things. You're working so hard, but you take your own feelings not seriously enough. Please give yourself that kind of kindness that you would offer to a friend, So that kind of compassion with yourself for what you're feeling. Exercise is huge in terms of managing anxiety and depression. It can be full-fledged exercise, or it can just be little snacks. Many of you will see me walking around the halls I call them my sanity strolls, but I try to, between every meeting, and I can't do it every single time, but usually 2 or 3 times a day, I do a lap of the building. And I just use it as this is 3 minutes that I'm clearing my head. I'm taking deep breaths. I'm doing something different than all the kind of sometimes stressful things I do all day. And then I'm dropping back into work and I'm better able to do what I need to do because I've taken those little snacks. So finding those little ways to do things like that. Sleep is critical. Again, if you're not sleeping enough, and so many time fly students are not sleeping enough because they're doing everything perfectly and all the activities or whatever, but if you're not sleeping enough, you are very likely to be much more anxious. You are very likely to be more sad. You're, all these kinds of things. So building a schedule as much as you can, and I know it's hard with how overcommitted so many of our students are, but as much as you can, giving that gift to yourself of regulating bedtime, getting enough sleep, eating healthy, those kinds of things really makes a difference. And then, of course, talking to friends, and if you need to, talking to a professional, So, again, we've got great staff here that you can talk to. One of the things that I do in my job is I do offer, I do some counseling here in school, but I also help a lot more students and their families find therapists outside of school. So if you feel like you don't want counseling in school, you want to keep that your business, I can work with, your mom or dad to, if they're willing to see what insurance you have, what therapists are available, what options are there. So, when appropriate, getting help. And then, of course, emergency numbers. If anyone's really struggling with thoughts of hurting themselves or someone else, 988 is the National Suicide Hotline. We have something in New Jersey called Perform Care. Your parent would have to call, but they can be in your house within an hour doing an assessment and then setting up free therapy in your home for 8 to 12 weeks. So even if your family doesn't have insurance, there's a way to access that. I can give that number, but you can also come to your guidance counselor and get that number. It's 877-652-7624. But so lots of different options for ways to help people.
And you say everyone's different, so for the most part, it's sleep, exercise, staying mindful, being in the moment, stuff like that, being kind to yourself and everyone else.
An addition I would put on there is the way we think. So often we start with, everything's terrible, it's all or nothing, as opposed to I'm frustrated about this, but I have this good thing, looking to change your negative thoughts and reframing them in more helpful ways is often a really good way to address mood and anxiety as well.
Well, thank you so much for your time.
Absolutely.
Please reach out to guidance counselors if you need help during this season. It's really hard and you're all doing great. Please remind yourself that you're doing great. Please have some perspective.
Absolutely.